Thank you, Mr. Chairman. Today we are considering H.R. 9228, Health Data Access, Transparency, and Affordability Act. This legislation is based on a simple principle. Employer-sponsored health plans should have access to the information they need to oversee the health plans they sponsor, so workers and their families are receiving high-quality, affordable care. Employer-sponsored health plans provide health care coverage for over 135 million Americans. The employers sponsoring these plans and the fiduciaries responsible for overseeing them rely on network service providers, including third-party administrators, pharmacy benefit managers, insurers, and other vendors, to perform critical administrative functions. Plan fiduciaries must have access to information in order to effectively oversee those service providers and evaluate whether plan participants are receiving high-quality benefits at a reasonable cost. Unfortunately, some service providers continue to restrict access to claims information, audit rights, payment methodologies, administrative fees, and other data needed to oversee plan operations and evaluate performance. In these cases, employers and plan fiduciaries face significant barriers to obtaining basic information about benefits they are paying for. These barriers prevent oversight necessary to evaluate plan performance, identify waste and improper payments, and ensure participants receive value from the benefits offered through the plan. This lack of transparency is currently costing American employers and workers billions of dollars in hidden fees and inflated costs. Look no further than the lawsuit filed by Kraft Heinz against its insurance carrier. Kraft Heinz discovered that its administrator was providing only edited data reports while blocking access to the raw medical claims. Why? Because the carrier was using its market power to negotiate lower prices from doctors, but not passing those savings back to the employer and its workers. Instead, it was pocketing the difference. They hid the spread, and they used data suppression as a shield to get away with it. We see similar behavior in prescription drug pricing. Employers face excessive costs because they cannot audit what they are actually being charged. In a recent federal lawsuit involving Johnson & Johnson, it was revealed that because of a lack of transparency, a corporate health plan paid over $10,000 for a 90-day prescription of a common generic drug. The actual retail cash price for that same drug at a community pharmacy is about $28. That is a 36,000% markup passed straight onto the health plan, hidden entirely behind a wall of proprietary secrecy. Bringing these prices into the light is the right thing to do for patients, and it is the right thing to do for small business and the employees themselves paying for coverage. My bill, the Health Data Act, builds on existing law by ensuring that group health plans and their fiduciaries have timely access to claims and encounter data, supporting documentation, fee information, payment methodologies, and information necessary to conduct meaningful audits. The bill also makes clear that service providers must provide this information and may not prevent or delay access. Importantly, this legislation establishes meaningful enforcement mechanisms to ensure compliance. The bill also strengthens the attestation requirements and gag clause protections previously enacted by Congress. Unfortunately, some have interpreted that previous legislation simply to prevent gag clauses in contracts, rather than as an obligation to actually give the employer health plans access to their own information. At its core, this legislation is about transparency and accountability. Plan fiduciaries cannot effectively oversee health plans, evaluate network service performance, identify improper payments, or fulfill their responsibilities to plan participants if they are denied access to basic information about how those plans are being administered. Workers and their families deserve health plans that are well-managed, transparent, and accountable. H.R. 9228 helps achieve that goal. This is substantially similar to H.R. 4527, passed through this committee on July 11th in the 118th Congress, sponsored by Representative Chavez de Remer and Representative Takano. This amendment, in the nature of a substitute, makes non-substantive technical changes to the bill, and I urge my colleagues to vote yes on the amendment in the nature of the substitute and in the underlying bill. With that, I yield back.